Hi guys, this is Tara Morrissey, and I will be going over the case study for HIV and AIDS. Some famous people that you might know that went through this is Freddie Mercury, Jonathan Van Ness from Queer Eye, and Magic Johnson. This study is reflective of a 35-year-old man named Michael living with AIDS. He was 6'1", 190 pounds, which would categorize him as just overweight with a BMI of 25. Michael's primary care physician suggested he came in today because if his BMI got any higher, it would highly affect his his infections associated with HIV and AIDS, as well as his cardiac function. So his only mode of physical activity is when he trains his dog show chow chows. He does not pay very much attention to his diet because he lives alone, he says. He shows a lack of confidence in his dating life due to his stature and his diagnosis. Michael's medications include Zyogen, Emtreva, and Epivir, and he has Rytaz, Prezista, and Lexiva. So, what exactly is HIV/AIDS? So, there's three stages, and in the first stage, it is HIV human human immunodeficiency virus. So this is the first 12 weeks of the virus. It spreads through bodily fluids, especially unprotected sex and contaminated needles. It targets CD4 cells known as helper T cells, which help defend the body of bacteria and fungal infections. And it spreads cell by cell by writing its genetic code into the genome of the infected cells, co-opting them to make more copies of itself. So it's writing its genetic code into the affected cells, co-opting them to make more copies of itself. So it's kind of like little boys teach each other how to curse, is how I like to remember it. Destroyer helper T cells in the process. They destroy helper T cells in the process by triggering the self-destruction mechanism, which increases the whole viral load. Basically, your body just feels like you have the worst flu of your whole life. Okay, the second stage is chronic HIV. So this is from year 1 to year 8. It's the same thing as clinical latency, as you can see in the graph. The blue line is representing the CD4 viral load levels, and the red is representing the HIV genome levels. So at some point after the 12 weeks, the rate of infection versus the rate of antibody production stabilizes for a few years. So the patient will be asymptomatic, but still infectious. So without treatment, the viral load slowly leans toward the destruction of helper T cells, and then you'll start to see symptoms again. And that's when it turns into the third stage, which is the AIDS, acquired immunodeficiency syndrome. So this is year 8 and on. So the helper T cells or the CD4 cell numbers get extremely low, causing the immune system to completely deteriorate. So that makes it a problem for patients to even beat a common cold. Medications, how they affect exercise. So every patient going through care will all have the same ART, which is antiretroviral therapy, which is just a combination of different HIV medicines to promote healthy lives. So what Michael's doing is he's taking 3 drugs in each of the 2 drug classifications, and the 2 are protease inhibitors and nucleoside reverse transcriptase inhibitors. Whew, mouthful. So the PIs are just block HIV protease, which promote the maturation of the host cells, causing HIV to be able to affect the other CD4 cells. And how they affect exercise response is long-term. Oh, excuse me. It says insulin resistance, and increases the risk of developing type 2 diabetes. So, not all good. So, for the NRTIs, they are they block reverse transcriptase and enzyme HIV in order to make copies of itself. And how they affect exercise is that many different art drugs, especially the NTRIs, are associated with metabolic and anthropomorphic health conditions such as dyslipidemia, abnormal distribution of body fat, and insulin resistance. Another issue for ART is that patients diagnosed with HIV/AIDS have to take at least six types of medicine every single day. So that's a lot to wake up and walk down and take a handful of pills every single day. So next is, how does exercise affect HIV/AIDS? Data suggests associations with cardiac dysfunction and increased risk of CVD among other patients living with HIV/AIDS. Exercise training enhances functional aerobic capacity, cardiorespiratory, and muscular endurance, and increases metabolic function. Progressive resistance exercises increases lean tissue muscle mass and improves muscular strength. Patients are at risk for osteopenia because of long-term ART. Long-term progressive resistance exercises may improve or sustain bone mineral density in the population without HIV/AIDS, and therefore could potentially be effective in delaying the onset of osteopenia among people living with HIV and AIDS. And of course, it increases mood and psychological status. So some conversation topics to cover before we would hit the gym would be, how familiar are you with gym equipment? What are your goals? Are you being regular with your medicines? When was the last time you were sick? And how are you feeling today? These are just general gauges on how to talk about their disease in a lighter situation, just to normalize it before we get started. Okay, exercise testing. We chose to assess the client's cardiovascular capacity through the YMCA ergometer test. We chose this because we felt it was the most convenient for the location, and test Michael, since he's been sedentary for a while, he should begin with something a little bit less grueling on his body, like beating on a treadmill. So these are the exact numbers that we found, and what we found from this was the client appears to be cardiovascularly fit and can be categorized as average based on the results. Although his breathing rate was slightly elevated, it's expected that the body of a fit individual would be able to return to a heart rate of about 100 beats per minute or less at most 5 minutes post-exercise. The client has seen his heart rate drop back down to exactly 100 beats per minute at 5 minutes post-exercise, which indicates that he's right on the border of being below average, but still considered average, so we won't worry about it. Okay, for resistance training, we will use the muscular strength testing, that is the leg press for the 1 rep max. We chose this mode of exercise testing because it will not affect the duration of the exercise, which is primarily what we're watching out for in this specific special pop. Since Michael is only slightly overweight, this exercise test would not be too much of a strain on his body, as opposed to a 1 rep max with, say, on the bar. So our results was he could squat about 180 pounds max. From these results, we can conclude that the client has substantial strength, especially for activities of daily living. We can also conclude that we are able to push the client in terms of what he can do, and graduate eventually to free weight lifting. So next up is balance. So For balance, nice picture there. For balance, we had him do just a regular standing balance test. These tests would be just two timed feet together, timed 1 foot in front of the other, and just to test his functional abilities. It's important to test balance, especially with this special population, because as a client with AIDS ages, they decrease in bone mineral density as well as osteopenia, which can affect balance. So what we found was 2 feet on the ground, eyes closed, no deviation for 60 seconds, and then only deviation at 15 seconds for 1 foot on the ground, eyes closed. From these results, we can conclude that the client could use strengthening of the muscles around the ankle to ensure stability as he ages, but nothing as severe as having to stop everything and just do a full balance work on him. Next is flexibility. So for flexibility, we chose just a classic sit and reach test to measure specifically the hamstrings and the lower back. So for this, he averaged about 12 inches. The client's results show that he's flexible. This is expected, and his diagnosis does not tend to affect flexibility. There are no concerns, nor are there any reasons that flexibility should impair any efforts of improving the client's daily activities. Okay, so now we are in the exercise prescription. So I'll start with aerobic. So for aerobic training, we decided 3 to 5 days per week. Begin at light intensity, which is 30% to 39% of heart rate reserve, which is about 86 beats per minute for light intensity. And given her heart rate reserve is 113. So that was pretty easy. And then so heart rate reserve is still 113. That would make her moderate intensity about 92 beats per minute. And he's going to do that, begin with 10 minutes and progress to 30 to 60 minutes per day. And I just thought he should do some walking, jogging, cycling, and swimming, because those use most of the larger muscle masses, and especially cycling and swimming because they're low impact. For resistance training, I said for 2 to 3 days per week, begin at a light intensity with a goal of gradual progression of 60% of 1 rep max, which for him would be 108 pounds. So we can start with that. We would start with 1 to 2 sets with a gradual progression of 3 sets of 8 to 10 repetitions. He showed interest in yoga. So we use free weights will be successful due to successful pin machine work. And for flexibility, we just said to cover the bases, 2 to 3 days per week, stretch to the point of slight discomfort, hold the stretch for 10 to 30 seconds, 2 to 4 repetitions for each exercise, static, dynamic, and or PNF stretching, all of that. I could give him a resistance band to teach him how to do his quads, his hamstrings, his arms, and his back. Special considerations. So when evaluating someone with HIV/AIDS, you must take into consideration these things. When a person has an acute infection, you have to postpone therapy. It is common for them to have a lower VO2 peak. Infection control measures should be taken by both the tester and testee. Use disposable mouthpieces to sterilize the equipment. Increase the cardiovascular impairments, particularly the cardiac arrhythmias. AIDS will dramatically reduce exercise time, VO2 peak, and ventilatory threshold. Predominantly minorities and people of lower socioeconomic status. And be aware of unintentional weight loss characteristics because it's characteristic of HIV/AIDS patients. Here are my works cited, and thank you so much for listening. Have a great week.